Early morning update Tuesday. The importance of immunizing your kids against potentially deadly illnesses became all the more apparent recently with the outbreak of whooping cough. This happens to be National Immunization Week at the medical community, trying to get your attention on this. Joining us this morning, Dr. Lance Rodewald. He directs the immunization program for the Centers for Disease Control. And doctor, my understanding is we expect kids, by the time they reach age 2, to have received 14 recommended vaccines. How are parents doing in that regard and getting their kids covered?
Well, in general, parents really are doing a great job taking care of vaccination of their children. The National Infant Immunization Week is designed to help encourage parents to protect their children against these 14 diseases by immunizing them on time according to the recommended schedule, and that really means getting everything done before their second birthday.
Where and how are we falling short?
Well, right now, I think the place for infants that we're falling the most short is the newest recommended vaccine, rotavirus vaccine. The coverage rate for that one is around in the mid-50% range, and we'd like to see that up around 80%, and so we're falling a little bit short there. Another one that we're falling a little short on is influenza vaccination, and that's a vaccine that, of course, has to be given each and every year. That's a little tougher one to give every year and takes a little bit more attention, I think, because it's given generally in the fall of every year.
There are parents who are concerned about side effects from vaccines. How common are they?
There are relatively common minor side effects for most of the vaccines, and these can include a sore arm or a sore thigh, and in some cases, fever. Serious side effects are very, very rare in vaccination and generally happen, if at all, at less than 1 in a million.
Despite the current research to the contrary, I know there are parents who are still concerned there is a possibility that childhood vaccines lead to autism. What's your bottom line on that?
That's a very good point. There's a study that was published last year that showed around a quarter of the parents did hold that belief, even though, as you point out, there's been many, many studies showing that there is absolutely no link between, for example, MMR vaccine and autism. None of the vaccines cause autism. This has been really shown quite well. Yet it takes a while for things that are sort of misinformation to go away. I think the good news is that parents in general realize that even though they may have questions about vaccines, there are ways that they can get those questions answered, and they are protecting their children through immunization.
How frustrating is it for you as director of the immunization program that there is some confusion, and how are you going about getting the word out?
Well, I don't know if frustration is really the right word. I think in general, parents, when they have questions, their questions deserve to be answered, and they deserve to get the best science and the best public health answers that they possibly can get, because we want parents to really be able to make decisions from a wealth of knowledge that they can make the right decisions for the health of their children. And there are plenty of places to get information about vaccines. One of the best ones is their healthcare provider, the doctor or nurse that helps to take care of their child. Another one, we do have some information targeted and designed especially for parents, and that's at our website, www.cdc.gov/vaccines.
We realized the importance of vaccines again just a few months ago, the whooping cough situation in California. I think there were 10 infant deaths. Yet there might be parents who can't afford to take care of this. What's the answer for them?
Yeah, that's a very good point. We'd like to have vaccines available to everybody, regardless of financial means. There's a 17-year-old program in the United States called the Vaccines for Children program, and this really helps financially vulnerable children to get access to vaccines. So if a child has no health insurance, for example, this program will provide those vaccines. In general, health plans in the United States do cover routine vaccination, but there is this Vaccines for Children program that will help if a parent doesn't have health insurance.
We will link the website the doctor mentioned to our site, 1190kux.com today. And Dr. Lance Rodewald, always a pleasure. Thanks for talking to us.
Thank you very much. I appreciate the opportunity.